on 800-4COIT.
Healthy Headlines brought to you by Novant Health.
It's Pride Month, so for Healthy Headlines, we are talking about LGBTQ Affirming Healthcare. What is it? What does it mean for healthcare professionals to provide it? Why is it so important to patients in the LGBT community? We have so many questions. So here to dive in and join in on the conversation, we welcome in Dr. Cramer McCullen. He's a family medicine doctor at Novant Health in Charlotte. Good morning, and thank you so much for joining us.
Thank you. Thank you for having me. Glad to be here.
So for some of us who are saying this is the first time I'm hearing this, what is LGBTQ Affirming Healthcare?
So LGBTQ Affirming Healthcare, it encompasses a range of services for patients, but at the heart of it, it's about increasing inclusion and equality. We want patients, when they show up to the healthcare system, to be able to identify themselves as who they are, to be able to be understood, to feel safe in their healthcare experience, and to receive the care that they need. We know that when we have patients feel understood, that they're better able to be offered services like preventive health services, achieve an accurate diagnosis, and be recommended for treatment options that they need when and where they need it. And we know that when we provide affirming care, the patients have better health outcomes because of that.
I love it. You want people to feel seen and feel comfortable. I think when we're comfortable, then we can really be honest and truthful in, what's going on in our life. And I really like this question right here. It says, patients are often asked by healthcare professionals, including Novant Health, to provide their sexual orientation and gender identity. Some patients might wonder, why is this important? Why do you need to know this? So what's the benefits to sharing this type of information?
I think historically, patients often feel that they can't be themselves when they approach their healthcare provider. There may be shame or guilt, or there may be providers who feel uncomfortable with that information. But it's important that as healthcare providers to provide the best care and the high quality care that you deserve, that we know who you are, what your family dynamic is, what risk factors you may or may not have, and what protective factors you may or may not have. And that helps us better care for you, and we understand that information.
I like that. Are you able to share some examples of what it looked like when someone was able to feel comfortable, not feeling judged, was able to share and be honest with who they were and what's going on, and how you guys were able to help them because of that?
Sure. So in our practice, we see a lot of LGBTQ patients, and often patients come to me. It's the first time that they've had a provider ask them questions about who their partners are and what their family dynamic is. And we've been able to access medications like HIV prevention. We've been able to offer pertinent screenings for cancer screening for patients. And often those things go missed if the providers aren't asking the right questions.
For more, please visit healthyheadlines.org.